I know what I went through in radiology. I know what I went through. So guys, you're welcome back to my YouTube channel. If you are new here, kindly hit the subscribe button and the notification bell so that you will be notified when next a video like this drops. If you're a returning subscriber, I want to say a very big thank you for watching our videos and for subscribing. In my previous video, I mentioned that I did my posting in internal medicine, radiology and pathology and some part of emergency. This video, I will be talking about my experience, like what I went through in radiology. I got into radiology like how I got into internal medicine, like when I got my posting application and when I got my posting department, the departments I was posted to, I saw radiology. And from my first, second and third posting, I have only been to radiology twice, so in just in the first and the second one. So this video basically will explain everything, all the procedures I did in radiology and everything I learned in radiology. So before I talk about my experience, I will just define what radiology is. Radiology is just a medical specialty that deals with the diagnosis, treatment and management of diseases using imaging techniques and modalities, and it has various units like the ultrasonography, mammography, X-ray, CT and MRI, and posted to 3 departments in radiology. I was posted to ultrasound, X-ray and films room. What did I do in this unit and what was I exposed to? What did I learn in this unit? I did radiology posting for like 6 weeks only in radiology, and before you get signed off from radiology, because then you have to get signed off from radiology then before you move to another department, or you have to get signed off from internal medicine before you move to radiology. So I needed to complete all my units. So I started off with ultrasound, and even before you even start with ultrasound, like every day you must go to the films room. This is where the radiographs that have been the radiographs that have been gotten from the X-ray room, it's where the doctors, the consultants interpret these cases and send out the results to the patient. So everybody is expected to be in that film room, and this is where everything gets hot, because here I can remember the first day I entered radiology. They just said, okay, go straight to the film room. I entered the film. Immediately I'm entering the film room, the consultant is bugging me with a question. Like they already believe that you should know this thing, even though maybe some of the things you're not even supposed to know them, but they expect you to just know everything. Like they expect you to just give answers to everything that they ask. I remember the first question that I was asked. Immediately I just entered, the man was like, okay, what's your name? I answered, department, physiology. I was like, okay, what is lumbar lordosis? I turned, I was like, am I the one he's asking this stuff? I thought maybe it was actually that you have to just be on your toes. I thought maybe that was going to be like that in internal medicine, but although I would say that what I expected in internal medicine were actually kind of the same, like it met my expectations. But radiology, I thought radiology was going to just be cool, just come to the clinic. Nobody's even going to disturb. You want to learn, you learn. You don't want to learn, you just go. But this one, it was worse than that. So you have to go through, I went through the films every morning. Then before then, you will not be assigned to your various units. Then I was still in ultrasound. I'll go through ultrasound. What did I do? Like I said, abdominal, pelvic, obstetric, and some part of transvaginal. Although most of those procedures, when they want to do them, the patients might not be very comfortable, or the doctors will just say, okay, you can excuse me. Most of them, I was there when those procedures were done. And I also got the opportunity to know how to take some ultrasound parameters and actually get familiar with them, because most times you'll be hearing intramural cyst, right renal cyst, all those stuff, myoma, and I was very familiar with them because you may not even know, and the doctor will just sit and tell you, okay, just write it down. And so radiology was just you must just be on your toes. Just get ready for anything, anytime, anything. What did radiology teach me? Radiology basically taught me how to be very attentive, like how to pay attention to details, because at the first few weeks, to be honest, I was not seeing anything. I was only seeing black and white. And in the black and white, I am not seeing anything. It's just some parts that have a thick shade of black and some parts that have a lighter shade of black. Then until I started putting my head down and I started asking questions, what are they even really seeing? They will tell me right renal cyst, I'm not seeing anything. So basically that is what radiology taught me, because before I finished my radiology posting, especially for pelvic ultrasound, I could actually identify the basic structures and calculate their diameters. Then for obstetrics, I could actually take some parameters, even the fetal heart rate. The only thing that was actually very confusing is, especially when you want to take acromial length, femoral length and all those stuff, but I could take some of the parameters in obstetrics. So that is basically what radiology taught me. Radiology exposed me just to be very, very attentive, how to just be attentive. For X-ray, I did not really do much. I was not really allowed to do most of the procedures because I think X-ray is more sophisticated. X-ray needs more kind of professional training, I would say, if it's right to use that. Although every other discipline also requires professional training, but I would say that X-ray is more complicated because when you want to expose the patient, you don't even know where to even keep it. You don't even know. You actually need to learn the positioning. There are a lot of things to learn in X-ray. So the only thing I was just doing in X-ray is just observing, okay, or maybe trying to prepare the patient before the exposing and trying to tell the patient what is involved, and also maybe trying to get the patient fire jacket, imputing details, making sure that everything is accurate before the radiographer or maybe the X-ray technicians comes and perform the procedure. So this is just basically my experience in radiology. I would say radiology is fun, but it is very tasking. Radiology is not really a medical specialty, it's not really a surgical specialty, it's just like in between. Like there is surgery aspect of it, there is medicine as clinical physiology was a specialty for radiologists before, like long time ago. Like people have to do medicine, graduate as a doctor, do residency in radiology before they can even talk about specializing in clinical physiology. And clinical physiology then covers all imaging procedures, both CT, X-ray, ECG, echocardiography, everything called imaging and diagnostics in medicine. So I think that is why, I don't really know if it's why I was posted there, but fine, I was posted to radiology. Now, people have also asked questions like, can a physiologist major in a field in radiology, like sonography, X-ray? The part is underexplored actually, because in this part of the world, here in Nigeria, basically, the specialty of radiology is just left for radiographers or medical doctors who want to become residents in radiology or want to become consultants in radiology. So, but if maybe you have passion for imaging like sonography, you can actually, so the part is like underexplored because in this part of Nigeria, the radiology field is just basically for radiographers or medical doctors who want to become residents in radiology or who want to become consultant radiologists. But if you really have passion for medical imaging, let's say sonography, you can actually take a diploma course in ultrasound and you can become a certified ultrasonographer. Or you can take a diploma course. I've seen some College of Health Technologies do programs like X-ray technician, X-ray technology courses. You can also take out those courses and enroll and become one, still with your physiology degree. So I think that is just the only path. I don't know if there are other paths. I don't really know about it, maybe about masters or PGD in any of those programs. I don't really know if it is, functioning here in Nigeria. So guys, thank you for watching this video till the end. Thank you for hearing my experience and what I went through in radiology. So if you found this video helpful, give this video a thumbs up, like this video, share this video, comment, or if you've also been in radiology, kindly share your experience in the comment section, and do help to subscribe and share with your friends. Thank you guys, and see you in the next video.